A history of plastic surgery. From repairing the damage wrought by disease, injury, and warfare to enhancing beauty, healers have long sought new and innovative ways to improve the looks and the lives of their patients. Let's take a journey through the history of plastic surgery, from its painful and primitive yet surprisingly effective ancient origins, through a few shocking case studies, to the modern medical procedures of today. The ancient Egyptians were pioneers in medicine and originated treatments for a variety of ailments. They successfully set broken bones and dislocated joints and bandaged them with willow leaves to treat inflammation. They used aloe for burns and skin diseases. They crafted surgical tools out of copper, including scalpels, pincers, forceps, spoons, saws, and hooks, which are remarkably similar to the implements used by modern surgeons. The first record of reconstructive surgery dates back to Egypt around 1600 BCE. The medical text, now known as the Edwin Smith Papyrus, describes treatments for 48 cases of injury, fractures, wounds, dislocations, and tumors. The papyrus describes treatment for repairing a broken nose and advises the doctor to manipulate the nose into the desired position before using wooden splints, lint, swabs, and linen plugs to hold it in place. Egyptians also tried their hand at prosthetics. A mummy has been found with a sculpted wooden toe, which likely aided the woman to walk in Egyptian sandals, which, much like modern-day thongs or flip-flops, would have been impossible to wear without a big toe. The Egyptians prized beauty and developed many of the first forms of makeup to accentuate their appearances. But in their quest for physical perfection, they were not yet willing to go under the copper knife. Without effective anesthetics and no understanding of germ theory and the need for antiseptics, surgery was incredibly painful and risky. Only superficial operations were attempted, and only when they were absolutely necessary. So if you needed your appendix removed, you were out of luck. And no one would have thought to face a likely death for beauty. By 800 BCE, doctors in India were practicing plastic surgery techniques as part of Ayurveda, meaning knowledge of life and longevity. This medical system built on acquired knowledge about the human body and is still practiced today. They learned a great deal about human anatomy by dissecting dead bodies. Ancient practitioners of Ayurveda utilized herbs to heal wounds, opium to reduce pain, and developed surgical tools. Ayurvedic physician Sushruta is known as the father of plastic surgery. His compendium, the Sushruta Samhita, describes over 300 surgical techniques, including reconstructions of the ears and the nose. Earlobes were often torn by wearing heavy earrings and became infected, but they could easily be sutured back together by doctors. Rhinoplasty, or reconstruction of the nose, was a lot more complicated, but it was an incredibly important procedure in ancient India. The nose was a symbol of dignity and respect. Therefore, amputation of the nose was a common punishment for criminals to forever mark them as untrustworthy. Women often had their noses cut off if they were accused of adultery, whether or not they were actually found guilty. Living with this disfigurement was, of course, incredibly difficult and traumatizing, so doctors were eager to develop treatments which might improve the lives of their patients. Sushruta recorded 15 variations for reconstruction of the nose, which involved cutting a flap of skin from the cheek or the forehead, and while leaving it partially attached to allow blood flow, suturing it over the nasal opening. Straws were positioned to recreate the nostrils. Honey, a highly effective antibacterial, and other herbs and oils were applied to the wound, which was wrapped in cotton bandages and allowed to heal. While the results weren't perfect, they were certainly better than having no nose at all. This procedure traveled to ancient Greece along the Silk Road and was known as the Indian method. The term plastic surgery comes from the Greek term plastikos, meaning the art of molding or sculpting. In 47 CE, Roman author Aulus Cornelius Celsus published Medical Encyclopedia de Medicina, which detailed a rhinoplasty procedure that was almost identical to Sushruta's technique. Ancient Roman doctors performed a number of surgical procedures. They built on Ayurveda, and although they still weren't aware of germs or their importance in disease, they observed the connection between hygiene and illness. So they boiled their tools and washed wounds in acetum, a mild acidic solution. In addition to rhinoplasty, which was occasionally performed for cosmetic purposes, ancient Romans could have their earlobes repaired, scars removed, and freed slaves could have their brands removed. In 695, Byzantine Emperor Justinian II was overthrown by his own people, and in punishment for his cruelty and despotism, they cut off his nose. From then on, he would be known as Rhinotmatos, or the slit-nosed. He returned 10 years later at the head of a foreign army to retake the throne. And he had a new, reconstructed nose. Once reinstated, Justinian was even more brutal than before. Within 6 years, his new army turned against him, and he was assassinated. Another monarch who required the aid of a doctor to change his appearance and regain his throne was Sancho I, who became King of Leon in 956. He was known as Sancho the Fat. Though obesity was a rarity in the Middle Ages, the king weighed in at 240 kilograms, or 530 pounds. He had an impressive appetite and ate 7 meals a day of 17 dishes each, mostly consisting of red meat and game. His people ridiculed him for being unable to ride a horse, fight in battle, or consummate his marriage. He was deposed after 2 years on the throne. His grandmother, the indomitable Queen Toda of Pamplona, would not stand for this. So she sent him to Cordova to be treated by Jewish physician Hasdai ibn Shaprut. The doctor devised a brutal weight loss regime for the former king. He was locked in a room with his hands and feet bound, and only let out once a day when he was forced to take long walks, during which he was pulled with ropes while leaning on an assistant. After the excruciating exercise, Sancho was subjected to lengthy steam baths, which were an even greater torment. To further prevent His Majesty from eating, Hasdai performed one of the first recorded weight loss surgeries. He sewed Sancho's lips shut, allowing only a small opening in which a straw could be inserted for him to sip a concoction of water and liquefied fruits, vegetables, herbs, and opium. This gave him constant diarrhea. These drastic measures did produce results, and Sancho lost about half his body weight. He was then treated with aggressive massage to try and firm up his flabby skin. Now able to ride a horse and lie with a woman, he retook the throne. He ruled for another 6 years before dying at 34 and leaving Leon to his 5-year-old son, Ramiro III. In Europe, surgery, plastic or otherwise, was stopped dead in its tracks by the Middle Ages. The Catholic Church preached that it was sinful to cut human flesh. Surgery was considered a pagan practice. In 1163, Pope Alexander III headed the Council of Tours, which banned surgery as well as the dissection of cadavers, the primary way doctors have always learned the anatomy of the human body and practiced techniques before trying them on living patients. During the Abbasid Caliphate in 750 CE, Ayurvedic texts were translated from Sanskrit into Arabic, and Muslim doctors continued to practice these surgical techniques. Translations secretly made their way across the Mediterranean to Renaissance Italy, where a handful of daring doctors defied the church to help their patients. There was a great demand for nose reconstruction at the time due to the popularity of dueling with rapiers, thin and extremely sharp swords. many a young man came home from a duel short of a nose. In the 1400s, Sicilian physician Gustavo Branca used the Indian cheek flap method to perform rhinoplasty. His son Antonio tried a different technique, using a flap of skin and muscle from the arm, keeping it partially attached to allow blood flow from the arm while the new nose healed. Once healed, the skin of the nose would be detached from the arm. This became known as the Italian method. Unfortunately, the patient was required to keep their arm elevated above their head for several weeks while their new nose healed. This was obviously awkward and uncomfortable, and the surgical area had a tendency to be jostled and the new nose become detached. Gaspare Tagliacozzi, surgeon and medical professor at the University of Bologna, continued to practice and improve upon the technique. He headed up a secret society called the Brotherhood of Death, a group of physicians and medical students who ministered to the condemned in the nearby prison. After the convicted were executed, the Brotherhood secretly studied their bodies. Tagliacozzi described plastic surgery thus: "We restore, rebuild, and make whole those parts which nature hath given, but which fortune has taken away. Not so much that it may delight the eye, but that it may buoy up the spirit, and help the mind of the afflicted." For his work to improve the lives of his patients, Tagliacozzi was excommunicated, and his techniques were largely ignored by Western medicine for the next few hundred years. In the 1700s, British military physicians stationed in India were fascinated by the surgical techniques of Ayurveda. They brought home many tools, which are the forebears of the implements still used in modern Western medicine. A report on Indian rhinoplasty was published in the Gentleman's Magazine in 1794. British doctor Joseph Carpew spent 20 years in India studying plastic surgery methods. In 1815, he performed the first rhinoplasty in the UK on a British officer who had lost his nose to the effects of syphilis. This destructive disease would soon put rhinoplasty back in high demand. The sexually transmitted bacterial infection was a huge public health problem from the 1500s until the 1920s, when penicillin was discovered. Before then, the only treatment available was mercury, which is toxic and caused a host of additional physical and mental disorders. One of the most devastating side effects of late-stage infection was necrosis of the tissue, which led to skin ulcers and lesions, often on the face, which could affect the tissue even down to the bone. So-called saddle nose, where the cartilage rotted away and the bridge of the nose caved into the face, was a hallmark of the malady. These disfigurations carry the added shame and stigma that went along with the disease known to be contracted through sex. To disguise the damage caused by syphilis, many patients turned to heavy cosmetics and prosthetics. False noses and masks were made out of metal and were often attached to spectacles so they could be easily worn. Another common symptom of late-stage syphilis was sensitivity to light. Special glasses were made with amber or brown tinted lenses, so the first sunglasses in the West were likely created for sufferers of syphilis. Once rhinoplasty was reintroduced in the West, syphilis patients who could afford it were eager to improve their visages through surgery. The first American plastic surgeon was Dr. John Peter Mattauer, who in 1827 pioneered the correction of cleft palates, a common birth defect, and designed tools especially for the procedure. In 1845, German doctor Johann Friedrich Diefenbach wrote a comprehensive text on rhinoplasty. He introduced the concept of surgery not to repair damage, but instead to improve the appearance of the nose. By the 1890s, cosmetic plastic surgery was beginning to emerge. American doctor John Rowe presented an example of his work, a young woman on whom he reduced the dorsal nasal hump for aesthetic reasons. Dr. Robert Ware attempted to use a duck's sternum to replace the bridge of a sunken nose. This did not work. Jewish German surgeon James Israel had more luck with bone grafting for the reconstruction of a saddle nose. A 1910 article called Getting Pretty Quick in U.S. women's magazine The Delineator details a 45-year-old woman's experience visiting Dr. Lander's private sanitarium for the complexion. For $300, about $9,000 today, she was dosed with cocaine and underwent a facelift, fully conscious. After the surgery, she endured 3 weeks of excruciating pain, during which her face was as red as a carnation. But after the long recovery, she was delighted that her visage looked no more than 3 years old. But it wasn't just the face surgeons were learning how to alter. In 1895, Bohemian surgeon Vincenz Czerny performed the first breast augmentation when he used the patient's own fat to correct her asymmetric breasts. Czech surgeon Robert Gersony experimented with Vaseline and paraffin as injectables. Initially, he had great success with the filling of face wrinkles and breast and penis augmentation. Patients left happy, and his techniques were popular into the 1920s. Many untrained hucksters posed as doctors and promised youth and beauty with these injections. But years later, patients developed serious complications when Vaseline or paraffin dispersed throughout their body and formed nodules which were very difficult to remove. Many patients died years after their initial treatment. The development of modern plastic surgery really got underway during the horror of World War I. The Industrial Revolution introduced new weaponry, more destructive than anything seen on the battlefield before. Military leaders on both sides hoped these catastrophic death machines would bring them swift victories. But instead, they resulted in an arms race, lasting 4.5 long years and causing untold human suffering. 20 million soldiers and civilians were killed in the conflict, and another 21 million lived wounded. While new technologies were the source of the devastation, they also made its victims much more likely to survive their injuries. Ambulances were able to rush the wounded to field hospitals, and innovations in surgery, anesthetics, and antiseptics greatly improved their odds. About 16% of the battle wounds involved the face. Chemical burns from mustard gas and hits from machine gun bullets and shrapnel left many young men severely disfigured. Their ability to eat, breathe, and speak hindered, and their employment and social prospects diminished. Prosthetics were employed to improve the appearance. American sculptor Anna Coleman Ladd set up a studio in Paris, where she made casts of the patients' faces and sculpted facial apparatuses to replace missing noses, jaws, and eyes. These were made of copper and painted by artists to look as lifelike as possible. Human hair crafted eyebrows and mustaches, and the masks were attached with string or spectacles. Ear, nose, and throat surgeon Harold Gillis of New Zealand and French-born U.S. dental surgeon Charles Valadier worked together on new techniques to treat many of these facial injuries through surgery. In 1916, they opened Britain's first plastic surgery unit, where they performed more than 11,000 operations on over 5,000 wounded soldiers. They did extensive skin grafts and rebuilt noses, jaws, cheeks, and ears. They improved on the Indian technique by creating tubes of skin rather than flaps to allow greater blood flow and thus a much higher success rate. After the war, Harold Gillis, now known as the father of modern plastic surgery, opened a private practice with his cousin, Archibald McIndoe, and together they continued to improve techniques and traveled the world to demonstrate them to other surgeons. The result was a slow but steady increase in the number of trained plastic surgeons and the demand for elective cosmetic procedures. In 1921, Johns Hopkins established the first plastic surgery fellowship program. In 1931, 1,500 people crowded into the ballroom of a New York City hotel to watch as a surgeon performed a facelift on actress Martha Patel. A reporter described the operation as about as easy as peeling a banana. Facelifts continued to be a popular way for Hollywood stars to maintain their youthful looks. Joan Crawford, Bette Davis, Lucille Ball, Fred Astaire, and John Wayne all went under the knife. In 1937, the American Board of Plastic Surgery was founded to ensure proper training of surgeons and patient safety. Dora Richter became the first person to undergo gender confirmation surgery. She physically transitioned from male to female over the course of 4 surgeries performed in the 1920s and 30s. Dora was one of a number of trans people in the care of sex research pioneer Magnus Hirschfeld at Berlin's Institute for Sexual Research. Dora was most likely killed when Nazis attacked the institute in 1933. When World War II broke out in 1939, innovators Harold Gillis and Archibald McIndoe went back to the front to improve the health and lives of wounded soldiers. Archibald observed that pilots who crash-landed in the sea had better outcomes than those who came down on land, leading to the discovery that immersion in sailing promotes healing. He also recognized the need to rehabilitate his patients psychologically as well as physically, and he developed programs to reintegrate them back into normal life. By 1942, there were 120 certified plastic surgeons in the United States, including Alma D. Morani, the first female plastic surgeon. She specialized in hand surgery. In the 1950s, plastic surgeons in Los Angeles classified small breasts as a disability called hypomastia. A variety of implants were tried to maximize the mammary glands. These included ivory, glass, wood, bits of rubber, ox cartilage, terylene wool, polyethylene balls, formaldehyde polymer sponges, and Teflon. These attempts at beauty often ended in serious illness and even death. Japanese doctors had been experimenting with injecting liquid silicone into the withered legs of polio patients. This technique was adopted for breast augmentation in the U.S., where some 50,000 women received liquid silicone injections. Over time, the resulting chronic inflammation of the tissue caused granulomas to form, resulting in infection, hardening, and pendulous breasts, and often required mastectomy. In 1961, American plastic surgeons Thomas Cronin and Frank Giroux and the Dow Silicone Corporation developed the first silicone breast implants, a silicone sac filled with silicone gel. In 1964, French company Laboratories Orion developed the saline breast implant. Silicone and saline implants are far safer and are still used today. Breast reconstruction for mastectomy patients was also pioneered, though it took until 1998 for federal law to be passed in the U.S., requiring insurance to cover breast reconstruction for cancer patients. Breast reduction techniques were developed in the 1970s and were found to relieve neck and back pain and have psychological benefits. In the mid-1960s, Dr. Milton Edgerton opened the first gender confirmation surgical unit at Johns Hopkins. He told a reporter, "The self-confidence and sense of wholeness is what it's all about. These people are already living as members of the opposite sex. It is gender confirmation surgery, not gender change surgery." Injections of botulinum toxin were used in the 1970s to treat facial tics and disorders of the eye muscles, such as crossed eyes. But in 1989, Dr. Richard Clark began using them to smooth wrinkles on the forehead. The shots were marketed as Botox and remain the most popular non-invasive cosmetic procedure today. In the 1980s, dermatologists Jeffrey Klein and Patrick Lillis developed tumescent liposuction using local anesthesia, thus making the surgical removal of fat safer and more affordable. In 2005, doctors in France performed the first partial face transplant. They removed the nose and mouth from a donor and grafted them onto a woman who had been mauled by a dog. A full face transplant was performed for the first time in Spain in 2010. Now that plastic surgery is better and safer than ever before, it has become more popular than ever. 17.7 million surgical and aesthetic procedures were performed in the US in 2018. In 2020, the most common surgeries were nose reshaping, eyelid reshaping, and facelifts. For many decades, breast augmentation took the top spot, but with the emergence of the selfie and people spending so much time on Zoom during the COVID-19 pandemic, the face has reclaimed center stage. The US takes the top spot for most surgeries performed, followed by Brazil and China. An entire industry of medical tourism has developed, with patients traveling abroad for less expensive cosmetic procedures. The future of reconstructive surgery is in regeneration. In the 2000s, German researchers developed a spray-on stem cell therapy for restoring the skin of burn victims. With the aid of 3D printing, techniques for regrowing the skin, ears, nose, and even limbs and internal organs are being developed. Whether for restoring what fortune has taken away, improving self-esteem, or enhancing beauty, science and medicine are forever finding new ways to overcome damage and rebuild the human body. And plastic surgery has come a long way. If you enjoyed this video, please like, subscribe, comment your thoughts, and check out my other royal history videos. If you really want to help, please consider supporting me on Patreon. A link is in the description. Thank you for watching.